Thank you for joining us for this month's Strengthening Families webinar. We're doing something that we do every once in a while. It's actually been almost a year since we've done it, which we call a virtual technical assistance clinic. We use our webinar time just to get questions from the field and answer them and talk together about some of the challenges and questions that come up as we're all doing this work in our own spheres and locations. And I'm glad that so many people wanted to join and submitted questions. So we're going to jump in. I'll share a couple of updates from the Center for the Study of Social Policy, and I just realized I did not delete the bullet point. Martha is not going to share updates specifically from the National Alliance today, but we are both going to jump in to answer the questions that have come in. And we will, I'll just share very brief updates actually from CSSP so we can really spend most of our hour on the questions and answers. So just a couple updates here about these webinars. We do this once a month. The webinars are always open to anyone who's using the Protective Factors Framework and coordinating Strengthening Families efforts, or who just wants to learn about the topic we're talking about in a given month. We convene these together between my organization, the Center for the Study of Social Policy, and our partners at the National Alliance of Children's Trust and Prevention Funds. And each month we have a different topic. This is a variation that we do maybe once a year, sometimes a little more often than that if there are a lot of questions coming up. But most of the time we have a dedicated topic and a guest speaker or a panel who share some of the work that they're doing related to Strengthening Families implementation. I'm going to click here. I see someone commenting about an audio problem. I'm not hearing that from anyone else, so if you can hear and you want to type in that you can, that would be helpful, or if your audio is breaking up, you can let us know that, and we will try to troubleshoot what's going on. So thanks, Vicki, for raising that. We'll see if anyone else has the same problem, and if not, you might just want to switch from phone to computer or computer to phone, or hang up and dial back in, the magic solution. So I wanted to say the recordings and materials are all posted at this Google site maintained by the Alliance. So usually by Monday after the webinar happens on Thursday, it will be posted there. And you'll also get a follow-up email with a link to the recording and GoToWebinar. So lots of ways to catch up if you missed one of these webinars. And there's a rich archive of these past webinars on that Google site. So we do this the second Thursday of each month. We're taking a break in August. We won't have a webinar just due to vacation schedules. And in September, we'll be back on the second Thursday, which is September 13th, talking about strengthening families and continuous quality improvement. That's a discussion that we are pursuing with our partners at Mosaic Network, who offer the Strengthening Families Evaluation Portal, but getting into some of the broader questions around what it really takes to do quality improvement around family engagement, and how the Strengthening Families Protective Factors lens and all the materials related to that can be useful. So hopefully that will be of interest to a lot of you. We'll get the registration details out in August by email. And then mark your calendars for those second Thursdays coming up, and I'll let you know the topics as they come closer. It sounds like some people have good audio and some people have it breaking up. I'm not sure how to help. Martha may be able to send you some troubleshooting tips if you're having trouble, but I'm going to forge onward in the hopes that most people can hear me well.
Cailin, I would just add that if they're having audio problems, if they're on their computer, just what you've always said in the past, sometimes it's kind of quirky and you might just want to change to using your phone for audio, or vice versa.
Yeah, thank you. That's our best tip we've got. It tends to work. Unfortunately, we don't know if there are other advanced tips, but it seems like switching from one to the other can usually solve the problem. And other people are typing in that they can hear clearly, so I'm going to take that as a thumbs up and keep going. So I wanted to make sure everybody knows that we have this new conference coming up. It's the first time we've done this. It's called Together for Families, Strong Families, Promising Futures. It'll be October 15th to 17th in Cleveland. The website is here. This is being co-hosted by CSSP and the National Family Support Network, as well as the Greater Cleveland Family Support Network. And we have several national partners involved in it as well, including the Alliance and Parents Anonymous and Help Me Grow. And I should not have started listing them if I don't have them in front of me. Oh, Be Strong Families. How could I forget? So a lot of our partners that have been great partners in strengthening families all along are joining together to put together this conference about family support and the standards of quality that come from the National Family Support Network, as well as about strengthening families. We are accepting session proposals through tomorrow. So by the end of your workday tomorrow, you can hit submit, send in a proposal, and then we've got a great group of volunteers who are going to be reviewing those to put together a great set of sessions for the conference. Early bird registration is open now through August 31st. So if you want to take advantage of those lower early bird prices, head to that website and get yourself signed up for the conference. We're looking forward to seeing a great group of people in Cleveland. One other brief update before we jump into our questions. Some of you may be aware of this already, but if you're not, there is a public comment session open right now, a public comment period open for the federal government for how they're going to be implementing some pieces of the Family First Prevention Services Act. And Casey Family Programs has a webinar tomorrow about this important opportunity to submit comments. If you're able to participate in that webinar, you'll be well armed to put together some comments. But even if you aren't able to participate in the webinar, if you've got some thoughts on how the government should implement this requirement for some evidence-based practices to be used for families and children where the children are considered candidates for foster care. Really, this is an effort to shift our child welfare systems to focusing more on prevention and more on keeping families together. It is a positive move, though of course the exact steps to take in that direction still need to be determined, and we're all hopeful that it can be done in a way that really helps strengthen families and keep families together. So please do look into this for how to submit comments, participate in that webinar if you can, and if you've got questions you can let me know, although I'll probably send you to another colleague who can answer better, but I'd be happy to connect you to the people who are following this really closely. All right. We're going to get to today's agenda now, and while we've done this before, we've made a little bit of some changes today. So some of you may have participated in this before, and we're making it, trying to get even more interaction going. So this is an opportunity to get questions answered, to learn from each other, to share experiences, and to identify opportunities to collaborate. So my dream is that one of you listening will hear a question that somebody else asks, and you will type in your answer, and the two of you will say, hey, we should talk, and you will get each other's email addresses, and you will talk about the similar work you're doing in your own locations, or you'll find out someone else is in your state trying to do something similar to what you are, and you can make that connection. So just really hoping to build that communication. It's not just about me and Martha answering your questions, but wanting to hear from the field about what you think. So we had 7 questions submitted in advance, and you are also welcome to type in questions. And you can do that in the question box. You can raise your hand and we can unmute you. The best way, if you do have a question to ask, would probably be to type in, I have a question, please unmute me, and we'll do that when we finish up another one. So what we've done this time, oh, I guess I had a slide about this. So you can use that questions box on the webinar panel and type something in. If it's something that you want everyone to see, we'll be able to just quickly respond to it and make it visible to everyone. GoToWebinar is not quite set up for the kind of conversation we're trying to have, but we're going to do the best we can. And you can raise your hand if you'd like to be unmuted to speak. Now, the innovation we've introduced today is that we're telling you the questions in advance, so that if you have an answer to one of these questions, you can already right now start typing in your answer. Or you can note that, okay, when this question comes up, I'm going to jump in. You might also scan through these questions and say, oh, nobody's asking the thing that I'm curious about, so I'm going to go ahead and type that in so we can get to it as well. And what you'll see in your in the webinar panel under the Handouts tab, we do have the slides for today, which the main benefit of downloading the slides is you can click on links that are in those slides. But you might not otherwise need the slides. But there's also a PDF there that's just a one-page document that lists these questions with the actual wording people used. and you might want that in front of you. If you're going to type in a response or a perspective on something that someone asked about, you might want to start it with Q4 and then answer your question to put your response to question 4 so that we can kind of track what's going with what. And when this webinar is over, I'll be able to go through all those things that were typed in and pull them into the notes under the right slide and share that version of the slideshow so that people can see what answers were submitted as well as listen to the recording if they like. So that's how we're going to try to get this going. Look through those questions, think about your own responses to them, and Martha and I will jump in and hope that a lot of you will also have things to share. So responding to the questions is me and my colleague Martha Reeder at the National Alliance of Children's Trust and Prevention Funds, and all of you on the phone. So here we go. The first 2 questions that we got are actually both related to healthcare settings, and we'll take the first question first and then the second one, but just wanted to highlight that they are kind of related. So the first question is, do you have pointers for educating learners? And this reference was to residents and medical students about strengthening families and implementation. And so I'm going to talk a little bit about the medical provider side of this, but there might also just be good tips for educating people in general about strengthening families and implementation. Some of your favorite tips, feel free to type those in. And maybe particularly for educating people who are already far along in a professional education, such as medical school and residency, how to weave this in with what they're already learning. So I'm going to share a couple of things, and then I think Martha's going to jump in too. We do have, there's a fair amount of work going on with using strengthening families in healthcare settings. The first thing I'll mention is Project Dulce. This is a model that was developed to try to get some attention to protective factors and a type of service similar to home visiting, but to do it when families bring their 0 to 6-month-old infant in for a well child check. So the setup is that a pediatric clinic will hire a family support specialist who meets with every family when they come in with an infant for a well child check in those first 6 months. The family support specialist goes to the appointment with the family, meets with them before and or after the appointment, depending how the patient flow works through the clinic. But then the family support specialist will ask the family about any concrete support needs they have, whether they're maintaining social connections, how they're feeling, how they're doing, all of those critical things that the doctor may not get to while focusing on the health and development of the baby, but that we know are really critical to the health and development of the baby and the well-being of the family overall. One of the great things about Dulce is that it takes advantage of some of those times when you're sitting in the clinic waiting for the doctor to come in or waiting in the waiting room or waiting for the nurse to come back to do the vaccinations or whatever those waiting periods are, where from the physician perspective, they might say, I have 12 to 15 minutes per patient. I can't squeeze this stuff in. But from a family perspective, when they go to one of those well child visits, they're very likely in the clinic for about an hour. And a lot of that time is not being used currently. So this is one way to have additional supports provided in that time that just because of the logistics of a doctor visit, the family needs to be there for that time. And what's also unique about Project Dulce is that it connects with medical legal partnership, so that if some of the cases that have come up where Dulce is being replicated right now, a family that was about to be evicted, and the medical legal partnership then stepped in and said, we're going to work with the landlord on whether this is a legal eviction, what options there are. A family that wasn't receiving Social Security benefits they were entitled to when the baby's father had passed away. The family support specialist can fill out the right paperwork. If there are snags in that, they can reach out to the legal medical partnership to get legal issues resolved for those families. A lot of immigration issues come up in these Dulce visits where parents are not sure what their next step should be, and the lawyers at Medical Legal Partnership have been really smoothing the way for these families to get them into the right kind of processes they need to be in to get the documentation or to whatever they need to do. So that's been really powerful, and just focusing on those first 6 months. And I encourage you, if you're interested in how strengthening families can be done in healthcare settings, check out Project Dulce. It's not currently available for replication broadly, as it's still being tested in replication, with local sites making, seeing what adaptations they need to make it work, and then testing how effective it is. But it is getting close to a second replication phase, and then hopefully soon after that will be available for others to use as well. I also want to mention that the Bright Futures, which is the guidelines, sort of the big thick book that all the pediatricians work from, with guidelines for their practice, there's a new edition of it that came out last year that does include protective factors, talks about the importance of family strength and about paying attention, in the context of social determinants of health, looking at what's going on with a family in the big picture, and then using family strength and the Strengthening Families Protective Factors as a way to address some of those concerns. So that came about with Bright Futures because the American Academy of Pediatrics has embraced Strengthening Families and Protective Factors framework. I'm showing a document on this slide that we co-wrote with the AAP maybe 5 years ago, but I think it's still really solid, going through why physicians should be concerned about family strength and how it connects with trauma and resiliency as well. So if you're working in the health field, I'd encourage you to check that out. It's on our website. I put the link right above where the image of the document is, and I'd encourage you to look into that. Martha, did you want to add anything here?
Well, I was considering the question that asked about how to educate learners, perhaps residents and medical students, and just thinking about the medical profession in general, and where would be some likely entry points where Strengthening Families approach could be used, and looking at existing structures that are in place in the medical profession. I'm thinking that the whole idea of racial disparities and the idea of cultural competence, cultural and linguistic competence is a place where I think the medical profession does try to address some of these things, and it would be a very likely entry point if you could find where this is being addressed in the different structures. There was a study in 2003 that said that in the clinical encounter itself, there was evidence that stereotyping, biases, and uncertainty on the part of healthcare providers can contribute to unequal treatment. So this is certainly something that could be addressed with the Strengthening Families approach, because we always consider cultural and linguistic competence as a part of everything in this approach, and it would be a likely place to look for ways in the structures that you know. I know that a lot of medical schools have cultural competency standard models they're trying to address, and other kinds of ways that they have guidance around things like palliative care and care for specific kinds of populations, and any kind of outreach for doctor-patient relations would be an appropriate a point of entry. And there's also a couple of committees that serve accreditation of medical students and residents across the country that have cultural competence standards. If there were any way to communicate with those existing committees and help them to embrace that strengths-based approach. So those are just some ideas about ways to interface with the medical community to get this information out there.
That's great, Martha. Thank you. I think your point about cultural and linguistic competency is really important too, both in terms of where you can kind of target that for medical providers and medical systems to see why this is important, but also because I think we've seen, and this is mostly anecdotal, but I have seen it and heard it from a number of people in the child welfare system where obviously disproportionality is a huge concern. There is a feeling that when you focus on family strength, you're much much more equipped to get past any bias that you, the professional, might bring into the interaction with a family. That focusing on strengths, talking to them about their strengths and what they feel they need is a much more humane and honorable way to interact with a family that then kind of gets you past some of the biases where you might be, as a provider, making some assumptions about a family or thinking in a deficit-based way. So I think in a medical setting, similarly, that strength-based approach and talking to families about their own protective factors can be really powerful. So thanks for bringing that up. We did get a follow-up question about Dulce here. So I'm going to read it. It's from Melanie, and then she had a second question too. So Melanie Sater, I hope I'm pronouncing that right, is asking, once the family support specialist asks the questions and here's what protective factors the family has in place or does not have in place, what do they do from there? So at that point, they act like, many of them actually are they're like a family resource center staff person who is located in the physician's office. So they do what family support specialists do, so they will resolve the concerns that they can. If they can say, okay, you need, you're eligible for this program and you're not in it, let's get you signed up. They might say, oh, you're struggling with social connections, let's make sure that you get to the play group that happens on Tuesday mornings at this time at this location, and what do you need to make sure you get there? And in some cases, maybe I will get you a ride or a transportation voucher to make sure you can get there. When they need to, they refer out to other services, so substance abuse treatment, domestic violence services, the medical legal aspects that I mentioned. So they will basically, like a good family support worker will in any context, they will not let the family go until they know that those needs have been resolved. And when families get to the 6-month age, the infant hits 6 months, and the family's not getting the family support specialist as part of their visit to the clinic anymore, there will be a handoff if needed, so that the, if they need some one-on-one parent coaching from the Family Resource Center, they will get them signed up for that and make sure that they are comfortable with their new support person and all of that. There have been cases of the families at 6 months saying like, no, I'm not going to stop talking to the family support specialist. She's great. She's the best part of coming to these visits. And in that case, it's a little harder to get them, do the warm handoff to another support that can continue to provide that. And I'm not sure whether any of the Dulce sites are looking at whether they could find financing and staffing structure that would work to continue beyond the 6 months, but right now they're focused on that 0 to 6 month critical age of transition to parenthood, and making sure that families' concrete needs are met. A lot of it is about the concrete support, but the family support specialists are checking in on other protective factors too.
Well, and I'm
wondering,
Cailin, if it could be that even though that you might not be able to exactly replicate this project, if they're looking at your own community resources, there might be ways to partner with local family support professionals, with the medical profession, that would work specifically for your community to help accomplish some of the same kinds of things.
Right, and to look at what structures are available. If there is a family resource center in the community, what resources could they provide to the clinic and to the families being served by that clinic that maybe it's an underutilized resource right now. So I think there's a lot of potential there, even without full replication, as you said, Martha. Melanie had a second question here, which is about any ideas for using the Strengthening Families framework in the early childhood field. I work with family support specialists and center-based child care centers. How can they use Strengthening Families in their work with families? And I'm glad you asked that, Melanie. That was actually where Strengthening Families began, was in what could we be doing, both in the type of early childhood programs that have a family support specialist and in places that don't. What can teachers and other staff be doing to reach the parents of the kids that they care for? So we've got a lot of content on that, but I think a lot of it is actually like what I just said, which is about the family support specialist in a clinic setting where it's, you're making a connection, building a relationship with parents so that they will come to you if they have any challenges, and then when there are challenges, you are helping them either you know how to solve this challenge they have, or you know who to put them in touch with to get that challenge met and to get the services they need. So it's really about kind of being that family's advocate until you are confident that they are in the right hands to have that need met, and probably then also checking back in to make sure that things are improving or that they're getting the service they need. But we have a lot of the content on our website on where we have the self-assessment program for child care centers. A lot of that really concrete things that either family support specialists or other staff can be doing are listed in that self-assessment.
And we also have a lot of content on the Alliance website that comes specifically from models that different early childhood programs adopted and implemented over the years, just some specific information from those states' programs in our Resources for Action resources, so you might check that out as well. Great.
I'm typing an answer here and hopefully sending it to where everyone can see. So Melanie, I hope that answered your question, and we'll go to our next slide. This one came from Tina Faber at FamilyCare Health Centers in West Virginia. How should we handle patient education in a health center after ACEs screening? And I think this is a really good and very timely question. So ACEs are adverse childhood experiences. We're seeing a lot of interest in the field right now in both screening parents, well, let's say that screening adults for ACEs, which is the way the ACE study was originally conducted, asking adults to look back at their own childhood and whatever adversities they may have experienced. So some of that happening with adults in general, some of it happening with parents looking at their own childhood. And Tina, in a separate correspondence, did tell me that this is for prenatal and for parents. So really talking to soon-to-be parents or parents about their own adversities in childhood and then working with them on how that might affect their parenting. There's also somewhat of a movement to be screening children, current children, for ACEs, which is a little bit of a different approach because it's not how the ACE study was designed, but it's all sort of part of the same conversation of how can the healthcare system use this knowledge that we have about the impact that ACEs have on lifelong health to improve people's health. How can we use that knowledge? But I think it's a little bit of a can of worms because I have some personal concerns that when we talk about ACEs, we often get into telling the very compelling story about how these adverse childhood experiences are correlated to poor health outcomes. And if we don't choose our words really carefully, we might be telling people that we're handing them a death sentence because of what they just told us happened to them in their childhood, right? Like it can be very stark. And you know, I'll share this personal anecdote a lot. A friend of mine was in a training. She worked in early care and education, and she went to a training about adverse childhood experiences, and she texted me during it and said, according to everything this lady is saying, I should be dead right now. And I said, raise your hand and ask about resilience. So she did, and they got a good conversation going about resilience, but it's not always part of the conversation, and that scares me a lot, I have to say, because we're, you know, as a society, we tend to think that we have two conflicting things. One is we think science is completely definitive, and the other is most of us don't understand science all that well. And so understanding the difference between correlation and causation is something that we know the general population and all of us sometimes struggle to understand. And if you just tell people these stark statistics, it can seem really dark. It can also have an unintended consequence of we're trying to educate people about why ACEs are important, and we're saying that people who have had these experiences are more likely to have these negative health outcomes. Someone who has a lot of those experiences in their past but feels all right about how they're doing might just write off all the science because they'll say, well, I'm fine. And all that stuff happened to me. What doesn't kill you makes you stronger. I'm fine. Stop talking to me about this. And stop trying to say that I should, be concerned about other children's experiences. So I think there's a fine line we need to walk, and we always need to make sure that the way we're interpreting that for parents, if we're talking about their own experiences, we're also talking about healing and resilience and what they learned from those experiences, how they want to make sure their children have a different experience than they did, kind of getting to the processing piece of it. And Be Strong Families has a great training that's about working through trauma by using the protective factors, and I wish that was the approach we were all taking. So the other piece that I always want to be careful of is not making parents feel really guilty about things their children have experienced that were out of their control or that they didn't realize were such a problem, that we don't want to give a sense of hopelessness and a sense of blame. And so the way that we interpret talking about this stuff is really important. I'm going to stop rambling for a minute and take a breath.
Well, I'm going to jump in and share about, I was on a call with one of my colleagues, Maureen Holliker, from the Great Start Collaborative in Michigan yesterday, and she was giving an example of in her community that she partners with the ACE Interface Master Trainer that is delivering training in her region of Michigan. And they have agreed that wherever one of them is, the other one will also be. And so they present both sides of the coin. They present the protective factor, the resilience side, as well as all the information about ACEs. And so there is, both the information, the very, pertinent and vital information about the ACEs, but also information about how to build those protective factors in your life that will make the difference.
That is great, and I also love that Kayla Grosshart typed in. Thankfully, all of the recent training I've been in about ACEs and brain impact have focused on the health of those who experience healthy relationships after the trauma. I think that's really important, and I think having parents understand the importance of nurturing relationships, that even though there may be negative experiences their children have had or are having, they can be a buffer, and they're maintaining their own resilience is a good way to help build their children's resilience as hard things happen, which we can't avoid. Tina, if you're on the line, I haven't checked the list, but if you want to chime in with any further sort of follow-up questions about that, please do.
I don't think she is. I checked a minute ago.
Okay. Thanks for checking on that, Martha. So I think I let out my rant about that. The one thing I'll say is if you're looking for concrete tools to use, I would say just, having that bridge language between talking about ACEs and then talking about the importance of buffering for children to, saying a lot of people have these experiences but don't experience it as toxic stress, the toxic stress response in their body, or saying, people have positive health outcomes even despite of this, and we think that's because of the importance of buffering relationships with adults and getting opportunities to heal and, really talking about that healing and resilience. If you're able to access the Be Strong Families content about going to one of their trainings about living the protective factors as a way to work through trauma, that will give you really good content as well. So I think we'll go to the next question, moving on through our hour that we've got here. Julie Day from the New Hampshire Children's Trust submitted a question. As we continue to implement the framework, is there any data that show we're moving the needle on child abuse prevention? This is a really good question, and one that I think is important to check in on. Martha, do you want to start? We talked through some of these questions in advance, and I know that Martha's got some opinions and thoughts about this as well, and I will try to rant less.
Well, we talked about the fact that there's so many different factors that are part of measuring how we're doing with preventing child abuse and neglect, that it would be very difficult to isolate one and say that the framework is making that difference. But the data does show that there has been a decline in reported child abuse but not neglect over the past few years. And so the accountability for what has made that difference could be a lot of different things, and also the fact that we have done so many things with strengthening families, and it's such a big part of. I was looking at a list of evidence-based practices just this morning, and I know that a lot of those have this strength-based approach embedded into them, and so I think it has definitely made a difference. It would be really hard to say exactly what that is. And for you specifically, for those of you who are out doing this work in the field, you may look at some indicators that you can measure in the programs where you have strong strengthening families work, and because you want to make the case for your own community and for your own region and state, and sometimes that requires you to take on those kind of special projects yourself. There is the NCANS report that has all this data in it, if you care to dig into that, and I have a link to that I could put into the message box, the chat box, if that would be helpful.
That would be great. Yeah, so I'll jump in here. I agree with everything that Martha said. The NCANS data is different from the child abuse reports and substantiations data because it is asking adults looking back at their own experiences and reporting abuse and neglect that they experienced. And so it's retrospective, but it is self-report, so it doesn't rely on whether someone saw what was happening, whether someone reported it, whether the system dealt with it the way it should. All of that really goes into those public figures that we have for the most part. But the NCANS data has shown a decline in physical and sexual abuse over time. It hasn't shown a decline on neglect, which has driven a lot of the work over the last few years, including a lot of it led by our partners at the Alliance, to say we really need to get a handle on neglect prevention. Why is this so pervasive? Why is it so hard to budge? And I think hopefully we're figuring out ways to actually make an impact on that as well, although it'll be a while before another NCANS survey comes out.
There are
yeah, go ahead.
I was just saying there are a number of initiatives that are trying to measure some of the maltreatment rates. There's an initiative called the Healthy People 2020 group that they've set a goal to reduce the rates of non-fatal child maltreatment by 2020, and just looking at their some of their goals and looking at some of the indicators that they're measuring might be helpful just to kind of wrap your mind around how that would apply in your own community. And there are other things that have happened in the past little while, like I can't remember, Cailin, maybe you can refresh my memory. The review on death, child death commission, the commission that just met recently.
Yeah.
Some of their outcomes, they had a lot of testimony that was part of that, and I think maybe some of those reports that came out of that commission might be helpful to look at as far as what things that can make a difference. I'm not sure if that is exactly the direction we're thinking about, but there might be some data from that as well.
Right. That commission was focused on ending child abuse and neglect fatalities, but one of the big takeaways from it was that the most effective way to prevent those most extreme cases is going to be to prevent abuse and neglect overall. And so some of the strategies there are really about raising the level of well-being in our communities in general and making sure families aren't slipping through the cracks and all of that. The one other thing I wanted to be sure to say with this question is I think a lot of us get this question, whether it's from funders or from partners that want to say, well, we've been doing this work for so long, why hasn't our county's rate of child abuse reports gone down? Or why hasn't, why aren't we seeing fewer substantiations? And I think what's important to remember is that those report numbers depend a lot on public perception, and they can go up when there's a high-profile case. They can go down because of a high-profile case that makes people think there's no point making a report. There's a lot of perception that goes into whether somebody calls CPS when they have a concern about a child they know. We want people to be calling more, so sometimes reports going up is a positive thing, but we hope that doesn't mean there's actually more abuse happening, but just that people are more attuned to it or more hopeful that the system could actually help if they reach out. So there's a lot there, and then what happens once a report is made is very dependent on protocol and procedure and who's doing what in a child welfare system, and so changes in those rates over time may or may not be related to actual changes in what's happening in the population. And so it's good to remember, take those numbers with a grain of salt. If we can have, we'd love those numbers to go down, but that wouldn't necessarily reflect that things have changed in the community, just like those numbers might not change or might go up, and that doesn't reflect that we haven't made a difference. Also, it's always important to remember that most of our communities and states, we are not funding prevention programs at a level that's actually affecting the entire population. And so it's hard to say, even with expanded home visiting, we're not serving all the families that would be eligible for or would benefit from home visiting. And so it's hard to say whether we could make a huge dent in those numbers if we had everyone getting the home visiting they need, because we just don't have that happening. So I always want to share that caution so that you don't get caught up with a county board member who doesn't want to fund your program because the rates haven't changed in the last 10 years or something like that. So it's an important conversation. These are important numbers to keep an eye on, but it's also a lot that goes into them that make them a little bit unreliable as reflecting what's really happening in the world. Okay, let's move on. I don't see any questions coming in right now or additional comments. We're going to go to our question 4 about how to reach parents of young children who are not connected to any social services. Maybe the ER is their only health care. And this came from Kate Englund-Ginn with the Safe Families for Children program. I think it's really critical to think about where families are going, even if they're not connected to any social services and they don't have a medical home. They're going to the grocery store, they might be going to church, they might be going to synagogue, they're going to the laundromat, and they're hopefully going to a park sometimes, right? So what are the things that we can do so that the people they do interact with are focused on family strengths, are attuned to family needs, and might say, put up a flyer about the Family Resource Center at the grocery store, or they see a family who's really struggling, the child's throwing a tantrum. Are there other adults in the community who are going to go up and say, oh my gosh, my child did that, it was so hard, and what really helped me was, and share a tip, or just share empathy, or say, I took this parenting class at the Family Resource Center that changed my life, and you should, if you're interested, you could try this too. So where are the services in the community that are outside of what we would consider social services, where people can at least find out what's available, but also maybe just get the support, some support that they need informally. And I do think faith communities are a really strong candidate for that, because there is structure there of who we can reach out to. It's a little easier than reaching the grocery store owners maybe. and they have a trusted role in families' lives and are often, for a lot of families, probably their most trusted place they go is their faith community, and their faith leader is someone that they really trust. And that can be a really helpful source of support. We want to make sure that those people have good information to share with people, know where else to refer in the community, and are seeing family strengths as they look at the families they're dealing with, and taking a positive approach.
There's some other sort of outside of the box things that we might not think of sometimes, like where do dads gather? You know, probably sporting events and things like that you might. Is it possible to provide information at places like that? And another idea is, do you have a business in your region that employs a lot of parents? Is it possible to engage with the parents through that business? What about, would it be feasible to have some kind of mobile service, like a mobile play group or a library or a storytelling service, or something, some way that you could connect with families in your community that that you could also share this kind of information?
Great points, Martha. Thank you. I'm not seeing anyone typing in anything here, but please do type in. One thing I'll share from our previous question, I didn't read this aloud, but we had a comment from Shasta County, California, saying that their Strengthening Families Collaborative includes ACEs in their mission statement. They say their mission is to strengthen families and reduce adverse childhood experiences by increasing protective factors, coordinating service systems, and engaging the community. I think that's a great way to sum it up, to have that reference to adverse childhood experiences, but really sandwiched in among all the positive things that you're focusing on. So I think that's great. Okay. Go ahead.
Oh, I just wanted to add one thing to this idea about reaching parents of young children who aren't connected to social services. Sometimes I think that we have a tendency to think of those families as hard to reach, and that sort of is a negative way of looking at it in some ways, because it sort of infers they might be difficult families or indifferent about their kids or something like that. But when actually the services themselves may be what's hard to reach. and so that I think that is probably something that we have to keep in mind, especially when we're looking at them in a strengths-based way.
Very good point. Yes, and families that are just going about their business and working on putting food on the table and getting their kids where they need to go are certainly not trying to be hard to reach. They might just be really busy and struggling with other issues that they're struggling because they love their kids so much and want the best for their kids. And we need to keep that in mind as we try to reach them with the types of services that we think would help them, to make sure that they also agree that those would be helpful to them. Okay, so question 5 is about in what languages are Strengthening Families materials available? And here I really want to encourage you, if you've got some Strengthening Families materials that you've translated or that you've developed in another language, we would love to add those to our collection. And I was actually going to show you the list that I've got going. I've put out this Google form that you can fill out to say what the document title was in English, what language it's translated into, what the title is in translation, who the audience is. You'll notice most of what we've got here, the audience is parents, but there are some also for professionals. And we're I think, there's clear reasons that most of the translated materials are for parents, but we do also want to think about how we reach providers who are not English speakers. So it's good to see some coming in for professionals too. A link to the translated documents, which I am happy to just post in our Google Drive. If you don't have it posted somewhere, you can just send it to me and I will post it there. But if you've got it on a website, we can share it from there. And then the entity that it came from, the contact information for that person, the name of translator is there if you want to fill it in, if there's a translator that others could also use. We just want to share resources as much as we can. So as you see, we've got Spanish, Haitian Creole, Mandarin, and Romanian represented here so far, and we'd love to have more languages and more materials. So if you have tools that you can share, please send them to me or go to this Google form and add that information. It's pretty painless. We'd love to keep that list growing. And Martha, I know you were going to share some information too.
Okay. We have just recently at the Alliance basically translated our entire in-person training into Spanish, and all the resources that are available through that into Spanish. Some of those are specific to the training, and it just, as you were speaking, it made me think that there are 3 little booklets that we have that started out, that originated through our Resources for Action project in New Jersey, and now we have translated those into Spanish, and I'm not sure they're on our website yet, but one of them is for parents. One, it targets parents specifically about the protective factors, and they're very simple and straightforward, just have definitions and what can you do to build this protective factor. And there's also a second set for child welfare workers, and there's one for child care workers. And so I'm going to remember to try and be sure those are on our website. I'm not sure they are right now, but if you want those, just contact me. I'll be glad to share them with you. And then there are other materials too that we will take a close look at making available. Many of them are very specific just to our training, but we will share what we can publicly with everyone. One other really exciting thing, it's not available right at this moment in time, but we are working with a group in Georgia, in Atlanta, to transfer our online protective factor training, which is 7 2-hour training courses, or 14 hours total of training, over to their platform, so that it can they have a lot more options that they can offer than we do on our platform, and so we're going to be moving it over there. We're doing it a course at a time. When we finish that process, which should be done by the end of 2018, then we are going to embark upon the process of translating it all into Spanish. So sometime in 2019, I anticipate having all of those courses, which now have over 26,000 people across the country using them, will also be available in Spanish.
That's great. Thank you. And if anyone else on the line has translated some materials, even if you haven't added them to my little list yet, you can share them here in the question box, and others will get access to them. And I forgot to acknowledge that question came from Sally Large at Friends of St. Francis Child Care in California. All right, our next question, and I realize we are coming up to the end of our time. We'll get as far as we can. This question comes from Patricia Herrera from 211 in LA County, asking about any programs that are using the Strengthening Families approach for families with children with developmental disabilities beyond the early childhood years. And I'm not sure if Patricia's on the line. I've spoken to Patricia about her program, and I know that they are really using a protective factors approach for families with children of any age who have disabilities and developmental delays. And I think the way they're using it makes a lot of sense. Our research for the foundation of the protective factors was focused on early childhood, but I don't think anybody's come up with anything that says once your child turns 9, you no longer need these protective factors. I think they're important throughout the lifespan, and it's a model that works for serving families, and as their children get older, I think it continues to work, but I know that Patricia is looking for others who have used it in this way going into later ages, into school and beyond. And just, I actually don't know of other programs that are doing that, so I would love to hear if anyone can share places that you know that are doing that. I will also add that if we run out of time and you have an answer to a question that you didn't get to share on the line, you can send it to me and I will get it back to the person who asked. I do see someone has typed something in here. Let's scroll down and see. Someone's asking to see the link for the Casey webinar tomorrow. I will scroll back up to that slide, and I would also encourage you, because it's one of these ridiculous links, maybe you can download the slide, or actually maybe I'm going to, this is a little odd, but I'm going to go ahead and click on this so I can paste the registration. Oh,
I think
Trish just did it.
Trish just did it. Thank you, Trish.
Trish just did it. Okay, so Trish just pasted that link into the chat box so that you can see it there. And I'll leave the information up on the screen for now. And Julie says thank you. So I'm not sure if anyone has other information about the question about working with families with children with disabilities beyond early childhood. I'm not seeing any responses to that come in right now. We've got a few minutes left, so I'm going to go to our next question, which was about what are, and anyone can chime in with any tips that you would want to share. Somebody asked, what are the top 5 tips that you would share for engaging families in out-of-school time programs? So again, here we're talking about families of older children and school age, but I still think it's an interesting question to think about. What are the best ways? So I will share what I think would be the top 5. No, I'll share a couple top. I'm not going to do 5. I think just as in our Strengthening Families work for early care and education, a big piece of it is just recognizing that your primary service you're providing is to the child, but the child is part of a family, and the family needs support in order for the child to thrive. So really building a relationship with the families and not just with the children. That would be my top thing, and then there are a lot of different ways you can do that, but I think if you're trying to have a potluck or an event with families and you haven't made a point of building relationships with them to start with, I don't think they're likely to participate. And so that level of family involvement that programs sometimes try to do, if it doesn't really start from a place of engagement and partnership, I don't think it gets very far. Anyone else want to weigh in with their thoughts?
Well, it's kind of subtle what you just said, Cailin, in that just the words that you used. I mean, you used the word involvement and then engagement and partnership. I think that just even the very language that you use when you're talking about parents, if you listen really carefully when you're listening to people talking about working with parents, you can tell what their, what their goal is and what their attitude is. In a lot of parent groups that I've worked with, I've heard this slogan a lot: nothing about us without us. And essentially, what can be more about parents than their kids and their children? And so I think that what you said is exactly on target, and thinking more about partnership with families and less about, using them, utilizing, involving them when it's convenient for you to do so. I think it's a real shift in the way you look at the way you're working in the program.
Well said, Martha. I don't see anybody else typing in their thoughts on this, and we are actually coming up to the end, so I think we might just take those as our closing words. So thank you, Martha. It's a great note to end on. I'm just putting up our email addresses so you can let us know if you have questions, if something didn't get answered, or if you wanted to weigh in and weren't able to. Thanks everyone for participating. Thanks to everyone who submitted questions. I think we always get into some interesting topics from the questions that come up, and I love seeing the ways that you all have chimed in with what's going on in your communities and what your thoughts are. So thanks everyone. Have a great rest of your day, and we will talk again in September. Thank you. Thanks so much, Martha.
You're very welcome. Goodbye, everyone.